with the American Heart Association fairly early in my career, as I was still training to be a doctor, because I had a mentor who said, that if I wanted to really understand how we can have an impact on heart disease, this was the association to be a part of. And I'm incredibly grateful for that advice, especially coming so early in my career, because I've been able to be engaged with the Heart Association now for almost 20 years. And the way I think about it is that I really cherish the interactions I have with my patients, and the fact that I can be there at critical moments in their lives, sometimes literally when life is on the line, and make a difference is a greater reward than I think is easy to express. But through my connections with the American Heart Association, I can also have a bigger impact, and that is understanding what science I can bring to bear to help my patients, but also by helping to drive an agenda that really is focused on preventing heart disease in the first place, which the Heart Association is all about. So Scientific Sessions is really the Super Bowl of the American Heart Association. Since it's a science-driven organization, what happens at Sessions every November, and this year we happen to be in New Orleans, is really the main event. And it's where literally tens of thousands of clinicians, that's doctors, nurses, physicians assistants, public health officials, and scientists from across the spectrum, people working at the bench, people working with clinical data, and people working on population science, we all come together in one place to share our best science and share our best ideas to move health forward. So it was exciting to see one trial from the Netherlands in which they took people who already had heart disease and engaged with Weight Watchers and a physical activity app, as well as a smoking cessation program online, to try to help people improve their health after they'd already had a heart event. And what they found was, in particular, they found real success when people engaged in these processes with a partner, a spouse or a significant other. If their social network was involved, they were much more successful, particularly at weight loss, which I think is an important insight that we could use here in the United States as we design these programs. A second trial looked at engaging doctors and patients more closely in blood pressure reduction. High blood pressure is the leading risk factor for heart disease and stroke worldwide. And we know that fully a third of people around the world have blood pressure that's too high, but only about 10% of people have that blood pressure controlled to levels where they're reducing their risk. So this was an intervention, again, with doctors and patients in Argentina to see if they could more effectively treat blood pressure. And they saw dramatic reductions in blood pressure and improvements in care by, again, using a multi-level complex intervention involving texting to patients, involving training doctors how to go through an algorithm to treat blood pressure better, and then a lot of in-home education about how to measure blood pressure and report it appropriately so that patients could get feedback on how they were doing. And the final trial was actually performed on the island of Grenada in the Caribbean, where it was using peer support groups, kind of like Alcoholics Anonymous, but focused on improving health behaviors and reducing cardiovascular risk. And they saw some modest, but I think important improvements in some of those health behaviors that should lead to reductions in risk and fewer heart attacks and strokes. So that's just a small sample of the kinds of science that we share here that many of us then can take home to our local communities or our new research studies to do things in new and better ways.